If you're pregnant and you're feeling a shooting or burning pain that runs from your hip or butt down into your leg, that's sciatica. And even though sciatica is common in pregnancy, you don't have to suffer through it. Hi, I'm Jaimi. I've been teaching about how the body organizes itself for a long time. In my other videos, I talk about a predictable pattern that's behind low back pain in pregnancy. Today, I want to talk about how that same pattern can contribute to sciatica, because I think the connection is more direct than most people realize. First, a quick note. Sciatica is a symptom, not a diagnosis. It means the sciatic nerve is being irritated somewhere along its path. That path runs from the lower back through your butt and down through the back of the leg. The pain, tingling, numbness, it follows that route. There are a few different reasons the sciatic nerve can get irritated during pregnancy, and I think the predictable pattern is often the culprit. It goes something like this. Your low back curves a little more than it used to. Your pelvis tips forward, your ribs flare slightly, and your pelvis in general tends to shift forward. Everything is reorganizing around this new weight in front of you. This is the pattern, and it's predictable because your body is doing what bodies do. It's adapting to your growing belly. And now you have this sort of perfect storm for sciatica. Think for a moment of the exaggerated curve at your low back. It changes how much space is available back there. And even on this little hedgehog, it gets pinchy. The nerves that form the sciatic nerve exit the spine right there at the bottom of your low back. When there's less room for the nerve to come through, there's more potential for irritation. Now look at the bottom of the pattern, and you'll notice that the pelvis tends to be in an anterior tilt. In terms of muscles, that tilt usually means tight hip flexors, underactive glutes, and a little muscle called the piriformis that ends up working too hard. That little muscle connects to the top of your femur and the bottom of your pelvis, which when tilted is shortened constantly. The sciatic nerve also happens to pass directly beneath, through, or around the piriformis muscle. Again, a perfect storm for the nerve to become irritated. So here's something simple you can do right now that invites your lower back out of its exaggerated curve and your pelvis into a more neutral place. Find a chair with a hard, flat surface. Sit towards the front with your feet on the floor. And now notice where you're feeling the weight on your sitting bones. Toward the front, the middle, the back. Based on the pattern, I would predict the weight is towards the front. Now think for a moment of your pelvis like a bowl of water. When your weight is toward the front, when your pelvis is in that forward tilt, you're spilling water out of the front of the bowl. See if you can gently find somewhere a little closer to the middle. Not tucking, not forcing, just finding a place where the water stays in the bowl. That's it. You just changed the relationship between the position of your pelvis and the curve of your low back, even slightly. That's the pattern being worked with in real time. Now, to take this farther, I think we need to support the part of you that's pulling everything else along with it, your belly. Those muscles that wrap all the way from your low back to the center line of your belly, like an intrinsic belly band. When you can gently engage them in relationship to the pattern, a couple of things happen at once. The exaggerated curve in your low back eases, and the pelvis has less reason to tilt, which also means the piriformis isn't being asked to work so hard in a position it can't get out of. That's something worth working toward, because the predictable pattern comes with you. Standing, sitting, walking, getting yourself out of bed. And what you need is an awareness that comes with you. That's basically what my course is about. Relief from pain through connection to your deep core. I filmed it when I was about 30 weeks pregnant with baby number 2. It was made specifically for low back pain, but often sciatica and low back pain are all mixed up. They're both expressions of the predictable pattern. By the end of the week, you have something that's yours, not a set of exercises, but a way of working with the pattern. And that carries into everything: how you get out of bed, how you walk, how you move through your day. The link is below if you want to go through it with me. Either way, I hope just understanding what's happening helps. Sending you lots of ease. Take care.